My name is Fawaghi Al-Ali and I'm a perio postgraduate student in Mohammed bin Rashid University of Medicine and Health Sciences. This poster is a systematic review and meta-analysis of the outcome of supportive peri-implant therapy on the rates of peri-implant diseases and marginal bone loss. Primary supervisor is Professor Momin Atiyah and Nabil Al-Sabiha. We know that the prevalence of peri-implant diseases in patients who are receiving dental implant therapy were estimated at about 63% for peri-implant mucositis and up to 19% for peri-implantitis. So among the potential risk factors for peri-implant diseases is the lack of supportive peri-implant therapy. The aim of supportive peri-implant therapy is to maintain healthy peri-implant tissues around the implant prosthesis and control any risk factors or indicators. There are several studies that have shown that supportive peri-implant therapy may reduce the rates of peri-implant diseases. Strong evidence for the influence of supportive peri-implant therapy on the maintenance of peri-implant health or on the reduction of peri-implant diseases remains unclear. Hence, the aim of this systematic review and meta-analysis was to evaluate the impact of supportive peri-implant therapy on the rates of peri-implant diseases and peri-implant marginal bone loss. Coming to the materials and methods, the guidelines of PRISMA statement were followed in searching for randomized control trials, controlled clinical trials, and retrospective studies in several electronic databases. The Cochrane Collaboration's risk of bias tool for randomized studies were used to assess the risk of bias, and the data were analyzed using a statistical software. Now, the primary outcome was the peri-implant diseases constituting of peri-implant mucositis and peri-implantitis, and the secondary outcome was the peri-implant marginal bone loss. To the results, a total of 159 studies were identified, 5 trials with 1,570 implants in 617 patients that have met the inclusion criteria. Now, the overall meta-analysis showed significantly reduced rates of peri-implantitis with supportive peri-implant therapy compared to non-supportive peri-implant therapy at implant and patient level. However, for the peri-implant mucositis was significantly reduced with supportive peri-implant therapy at an implant level only. Peri-implant marginal bone loss was significantly reduced in patients with supportive peri-implant therapy compared to those who did not attend the supportive peri-implant therapy. In the first two upper graphs, we can see the rates of the peri-implant mucositis at the patient level on the left and the rates of peri-implant mucositis at an implant level on the right that favors the supportive peri-implant therapy. Now, two graphs in the middle that represents the rates of peri-implantitis. On the left is the patient level and on the right is at an implant level, and both of them favors the supportive peri-implant therapy. Now, the final graph at the lower middle side compares the supportive peri-implant therapy versus non-supportive peri-implant therapy in terms of the peri-implant marginal bone loss. And we can see here it favors the supportive peri-implant therapy, as these patients had reduced marginal bone loss compared to those who did not attend the supportive peri-implant therapy. So, as a conclusion, it is clearly that the supportive peri-implant therapy can significantly reduce the rate of peri-implantitis and marginal bone loss. So the evidence on the role of supportive peri-implant therapy on reducing the rate of the peri-implant mucositis remains limited. We do require further well-designed studies on the impact of supportive peri-implant therapy on the implant treatment outcome. Thank you.